Thank you so much, Allie. Appreciate it. What we're going to talk about today is tobacco dependence treatment, specifically in the healthcare setting. It's a little different in some situations. So, what we're going to start with, whoops, sorry, get a little quick there. The Indiana tobacco data, this is the most current data that we have at the state level, which is in 2022. They're usually a year or two behind. But you can see that Indiana's 2022 smoking rate is not really much different than the one the prior year. So we are making some significant progress, but not a lot. But certainly where we once were. So we have a significantly lower among adults, or females, the Hispanic racial group, and those that are 18 to 24 or 65 and over. So we are seeing some declines there, which is good. Then we have the current smoking demographics for the lower education levels and lower income levels, which you can see correlate directly with smoking rates. Unfortunately, that continues to be the case. And then the 14 or more poor mental health days or have been diagnosed with depression. We do see that in some of these populations. You can see on the slide, and there, some really significant situations are going on there that they need a little extra help with. You can also see the poor mental health. The LGBTQ population is there as well as children of childbearing age. The current e-cigarette use demographics in 2022 has really kind of stood similar, unchanged in terms of at the 8.1%. We have significantly higher rates of e-cigarette use among adults 18 to 34. So you can see those there, and that's not surprising. So that does occur. And e-cigarette use demographics, we're looking at lowest income levels and lower income levels, and those again are higher rates at higher rates. Yeah, higher smoking rates at higher rates. E-cigarette use trends, you can see this is a little bit more comprehensive. Again, remains high at the 18 to 24, they said. So there are still quite a few fluctuations with the e-cigarette use rates. They are coming down a little bit with some of the younger kids, but there's still a lot of work to do. Vaping educational opportunities can be found at the Smoking Cessation Leadership Center. It is a California-based organization. They do offer CMEs, and then there's a link there. You can get with me later if you want that, or want to visit the slides at a later time. But if you want to learn more about vaping specifically, this is a way for you to do it as a provider. The health systems change. What Indiana Rural Health Association is doing now is we are working with the state to conduct outreach to rural health clinics, critical access hospitals, local health departments around what we call health systems change. Strategies for health systems change have been identified by the state program, the State Department of Health, and the Tobacco Prevention and Cessation Program. So basically what it does is it's a provider toolkit. It talks about tobacco-free recovery and help for the health system to better understand the processes that are involved. So it provides tools and resources to support the system's change for tobacco treatment. It also has 4 strategies that address integrating tobacco treatment services into clinical settings. So strategy number 1 is basically to try to implement a protocol that ensures every tobacco is identified and offered evidence-based treatment at every visit. And evidence-based treatment would be pharmaceutical therapy, counseling, medications, any of those types of things. Now, our Quit Now Indiana Quit line does offer counseling services for free for those that enroll. And with the enrollment, they can also get the patches, the gum, or the lozenges for a period of time. So what we're really advising here is to ask, advise, and refer. So what we want to do is treat tobacco dependence as a chronic disease that it is. When we have a patient that has a heart disease, has diabetes, we're going to keep counsel them on a regular basis about that situation. And really what we need to do is try to bring tobacco to that forefront. It is in the DSM as far as a chronic disease, and we need to really treat it as such to make the headway with it that we need to. So when we want to ask every time we see that patient. We want to advise them, where they at with their quit attempts. Are they ready to quit yet? If they're not ready to quit, what could we do to help motivate them to quit? And then make a referral to an evidence-based program such as the Quit Now Indiana Tobacco Quit Line, which is evidence-based and a very good program. Like I say, it's free. It includes medication if someone enrolls in it, and can be very, very helpful. So strategy number 2 is to provide education, resources, feedback, promote interventions with patients who use tobacco annually, or at all, really. Suggested trainings might include things like the link between mental illness, substance use, and tobacco dependence. There's direct correlation. Screening and assessment tools that help not only with tobacco dependence, but mental health and substance use disorder. Motivational interviewing can be utilized in a number of different ways to motivate people to make behavior change. And then workflow training to work with the health facility to look at their workflow of patients that use tobacco use. How do they address those? Do they address them consistently? Do they get them the help that they need? There's lots of stops and goes perhaps that work. So there would be some things to look at in that realm. Tobacco treatment specialist is a highly trained individual that is trained in tobacco treatment. It's a 3-day training. It's very involved. It includes motivational interview. It includes pharmacotherapies, all kinds of things having to do with tobacco treatment to help those individuals quit. And it is a continuing education credit as well. So it's very worthwhile for those that have an interest in doing this. Strategy number 3 is to have dedicated staff that support tobacco dependence treatment and recommend assessing the delivery of the treatment in staff performance evaluations. If you're going to evaluate this as part of someone's evaluation, then you want to make sure that they're doing it properly and to the highest of their ability. So, to work with them on that and get to that place would be great. So every patient would want to advance through each step of that agency from the time of arrival to departure. And then even after departure, you can do some follow-up at home, that kind of thing via phone call, those kinds of steps. Okay, strategy number 4, consider designation of a tobacco dependence treatment advocate for selected settings. For example, if you've got a peer support model to promote tobacco dependence and recovery at your organization, that would be a great place to start. Peer specialists can facilitate positive change. They've been there before. They've been through it. They know how to win the battle, so to speak. They have goal setting, education, skill building, by sharing their own journey and modeling healthy decision making. I've smoked in the past. I'm not going to lie about it. I have. And when I used to teach classes, I had people ask me that all the time. And it does validate to some degree that you've been there. So it's just a way that people can relate. Health systems change can make a difference in performance measures at a hospital setting. Increasing referral numbers doesn't hurt a darn thing. Increasing a number of staff trained on the Quit Now Indiana tobacco quit line. Increasing the number of staff who ask, advise, and refer. Ask, advise, refer. Actually, there's 5 A's that come out of the clinical practice guidelines. And the ask, advise, refer really just simplifies it down to make the referral to the professional and go from there. Meeting accreditation standards, this can play a part in that. And making Quit Now Indiana referrals convenient and easy. It's not hard to do. It takes a little time. Ultimately, what we'd like to do is for you to have it incorporated into your electronic medical records. So where it becomes a sustainable long-term project. And then increasing patient tracking efficiency. Again, documenting everything that you're doing with the patient and tracking that is very important to your accountability and so forth. And then encouraging continuity of care. That's just really important, is we want to make sure that we're doing this consistently with everyone that needs it. So health systems change and electronic referral or e-referral allow clinicians to address tobacco treatment consistently and effectively. And so we just need to help our providers get this in place. And it does take a little bit of time, and we're here to help with that. So don't hesitate to let us know if it's something that you have an interest in. The Quit Now Indiana Champions Program is a new program that they've just come out with. They want to promote the quit line treatment services. They want to increase referrals, and we want to encourage evidence-based health systems change strategies, and also increase enthusiasm efforts for the Quit Now outreach. So the Quit Line has helped many, many, many people, and it continues to do so. It is a good program. It's, so enrollment, medical providers visit the Quit Now Indiana Champion Medical Provider enrollment page. That is listed here on the screen. The enrollment does not provide referral options. Referrals must be made through the online referral portal. And if your healthcare facility gets to the point where they want to look at these kinds of things, I'm glad to meet with you in person, virtually, and walk through these things without no problem. The benefits of using these services and helping to address tobacco dependence is that you'll get an email and a monthly Quit Now Indiana e-blast with information. You'll have links to free materials to educate patients about tobacco use and treatment services. They have gotten a lot more specialized services because of the needs of some of the demographics that they have. Status reports on fax referred patients, letting you know whether the patient enrolled, services, or planned a quit date. So they do communicate back with you when you do make those referrals. And then also we have folks like myself. I'm at a state level when I'm working in tobacco control, but I also have colleagues that work at a community-based level that could, if you need to be put in touch with them, that can be arranged. So glad to do that. Here is the Champion Awards program for the Quit Now Indiana Champion program. It's there's 4 different levels: bronze, silver, gold, platinum. One is just 10 referrals a year, which is really not very many, and you will get bronze level. Silver level would be 10 more, plus having tobacco-free grounds policy. And that would include not only tobacco-free, but vape-free as well. Gold would be the 10 grounds policies, and then working to incorporate the policy workflow and treatment benefits with either healthcare providers or employees, whatever the case may be in this particular situation. We work with healthcare providers and employers. And then lastly, is including the healthcare provider referral integration that I mentioned about having it be as part of the EMR. And that would be the case also with an employer. So it's kind of a full package deal. And it is worthwhile pursuing. So that's all I have for you today. My number is there at 812-870-4056. And my email is kwalker@indianarha.org.